Well, there you go, ladies and gentlemen. We call this a practice-changing plenary for a reason. We select only the highest quality randomized data to present in this forum so that we as clinicians can consider the evidence and see whether it's worthy of changing practice. My disclosure on this is that I've been an advocate for transperineal biopsy for very many years. I've written lots of articles about it, usually saying that transperineal biopsy is a much safer way of doing a biopsy. And I want to acknowledge that bias as I consider this evidence today. And this is the question, of course, in a practice-changing plenary: is this the end of the road for trust biopsy? I want to first briefly remind you of the 100-year history of prostate biopsy, because it was perineal approaches to the prostate which dominated the first 50-odd years of prostate biopsy, largely due to concerns about infection. And these images reflect that data from back the mid-part of last century. And it was really only the advent of truss imaging, and especially higher quality truss imaging, that led to truss biopsy becoming a more attractive option. And of course, then as we entered the PSA testing era and standardized methods for biopsying the prostate, it was this that has led to truss biopsy being our standard of care all around the world for most of the past 30 years, with about 3 million biopsies per year being performed. So one of the most common things we do as urologists. And in this last 30 years, actually transperineal biopsy was mostly becoming extinct. Until I think really in the last few years, when thanks to initiatives like local anesthetic techniques and little gadgets that can help us do a transperineal biopsy in an office environment, that has led to where we are today, which is with 4 randomized trials published in the past year evaluating truss biopsy and local anesthetic biopsy. Importantly, in an MRI era, almost all patients in these trials have had a prostate MRI. And before I summarize that data for you, let's have a little thought experiment. Let's pretend that it's actually been the other way around, that it's been transperineal biopsy that's been our standard of care for most of the past 30 or 40 years. No antibiotics, minimal infections and so on, but maybe a bit uncomfortable and a bit time consuming. And let's say that these trials are evaluating truss biopsy as an alternative to the standard of care. Yes, we need antibiotics, maybe more infections, but perhaps it's going to be faster and a little bit more comfortable for the patients. So what have the 4 trials shown us? And congratulations to all of these authors from UK now, US and France for conducting these trials. The primary endpoints are a little different. Not everybody looked at infection, not everybody looked at cancer detection. And the real headline from Translate, of course, is their primary endpoint in a very well-powered study to detect this endpoint, showing us that there's an increased detection of clinically significant cancer. Other trials didn't show that, but we're not powered in the same way as Translate. And the second key question is about infections. And you know, I think these trials have really challenged those of us who've said truss biopsy is a dangerous thing and we shouldn't do it, because infection rates have really been very, very good in this. And we can reassure ourselves and our patients that with antibiotics, either targeted or augmented, you can perform a truss biopsy with acceptable infectious complications. And the pain and symptoms that Richard drew attention to are something we need to consider in the immediate conduct of a local anesthetic biopsy. So overall, I think these trials are showing us that, especially with Translate today, showing us the cancer detection rates are lower for a truss biopsy compared to LATP biopsy in the MRI era, and the infection rates are about similar. So if you go back to my idea of flip it the other way around, and let's say that transperineal biopsy has been the standard, and now we have truss biopsy in randomized trials, would we accept truss biopsy as the new standard of care? Well, it depends, I think, really on which you think matters most. Is it the infections or is it the cancer detection? And this quote that you see here is from a podcast that we recorded with Richard just a few days ago, which has just been posted actually in the last few minutes. And memorably in this podcast, he said, "A man does not have a prostate biopsy to avoid an infection." Okay? He has a prostate biopsy to find out if he's got significant cancer or not. So I think cancer detection trumps infection. And what we've shown, what we've seen here from Richard and co. is that cancer detection rate is inferior in the best powered trial we have to date. And we know that to make prostate biopsy safe transrectal, we must use antibiotics. And that's the second thing I want to draw your attention to is, this issue about antibiotics is not going to go away. In fact, it's going to become a bigger and a bigger issue for society in the coming decades. And although we've written in the past about this, myself and Jeremy, who's here in the audience, we simply said if we just stopped putting the needle through the rectum, we wouldn't have to use antibiotics. And I believe that will become a more and more important issue for us urologists, especially now a trial is showing you have a better detection rate with no antibiotics. What do the guidelines say? Well, they've really strengthened their recommendations for transperineal biopsy in recent years, saying due to the lower risk of infectious complications, we should do transperineal biopsy. In the update this year, they added into the guideline better antibiotic stewardship as an additional reason why we should consider transperineal biopsy. So what are the guideline committee going to say to us next year? I estimate that they will continue with the strong recommendation based on infectious complications, but they might also add in better cancer detection rate. So therefore, ladies and gentlemen, is this the end of the road for trust biopsy? I don't think it is. I think that what these trials have shown us is that both approaches have merit. However, the data on cancer detection for LATP is, in my view, convincing. The reality of antibiotic stewardship may become even more important in future years. We may be told, you cannot use antibiotics for this trust biopsy because you can do the same procedure without antibiotics and have a better cancer detection rate. But we have some challenges. Can we reduce that immediate discomfort rate? Can we make it a shorter procedure, a little bit more cost-effective? And I think ultimately all patients should now be offered the option of LATP. All of you in the audience who do trust biopsies next week should consider, why am I not doing this local anesthetic TP biopsy? Because that's what these trials have shown us is feasible in all urology practices. And as I say, we've just posted an episode of our podcast. Myself and Renew interviewed Richard and his co-lead, Alistair Lamb, during the week. So we've got a very detailed 40-minute discussion. You can just search GUcast, and that episode has just posted. Thank you very much.
Thank you very much, Declan. Excellent discussion. You raised all important points.